Yeah, Dana. Thank you so much for coming in. I'm really excited to have this conversation. Obviously, this topic's taken kind of our world by storm, specifically those that serve the special operations community in the last 8 years. But I'm curious to hear your background into it, like how you got involved, what you do, let everybody know. But let me start first with an introduction. Dana Lerman, sorry, I'm starting to have eye issues. Medical doctor is a physician with a background in internal medicine and infectious disease, and the founder and medical director of Skylight Psychedelics, a national training and ketamine corporation platform dedicated to ethical, accessible psychedelic education and care. During COVID-19 pandemic, she founded the COVID Consultants, a national testing and business risk mitigation practice that supported organizations across the country in navigating unprecedented public health challenges. She also is the co-founder of Starlight Clinical Research, advancing innovative treatments in psychedelic and neuroscience-based mental health care, and serves as medical director of a vertically integrated state-licensed psilocybin healing center in Colorado, overseeing safe and compliant natural medicine services. Her work bridges modern clinical frameworks with indigenous wisdom informed by time spent in
Putumayo
jungle, sitting with the elders of coffin lineage and assisting in traditional ceremony. Beyond clinical settings, Dana volunteered for 3 years with the Zendo Project, providing peer support at Burning Man, and is the founder of Aya the Tiger, a peer support focused Burning Man camp rooted peer support focused on community. Across clinical research, jungle, and playa, her work centers on stewardship, reciprocity, and the responsible evolution of psychedelic medicine. Dana, really great to have you.
Thank you, Chris. A long bio. Sorry, I didn't really realize how long it was.
No, it's okay. I know sometimes you had presentations and different things. You hear somebody read it off and it's like, man, that's a lot. Amazing background. And obviously just the person that we wanted to sit down and introduce and ask questions. So just to give you a back kind of picture of who our listeners are, our watchers are, and then some of the people we work with. So SOF Network, obviously we focus on serving the special operations community, but also veterans, first responders. There's a lot of academics as well that have their feet in academia as well as the clinical space. And so with the emergence of psychedelics in the last handful of years, as a provider myself, I've been, starving for information to sit down and not just read an article and whatnot. Like I wanted to talk to somebody that's been in the space, that's been doing it. And so I got your contact and information from Lindsay, who was awesome.
So spoke to her this morning.
That's cool. So give us a quick rundown, who you are, where you came from, and then obviously, how'd you go the medical school route, and then how'd you find psychedelics, or it found you?
Okay. So I'm Dana Lerman. I'm a physician. I am from New York. I was actually born in the hospital that I did residency in, which is
Cool.
fun. Doesn't happen for a lot of people. And then I went into the field of infectious disease. And I became, like in my bio, became an infectious disease doc and worked for, I don't know, a long time in that field, 20 years. And then in the pandemic, I started my own COVID consulting practice where we were doing testing at people's homes with really rapid turnarounds before really anyone was doing it. And then I was also traveling a lot all over the country to helping businesses to stay open. And that was a really traumatic and challenging experience for me. I also worked in various hospitals. I went out to California. I was in hospitals there where there were multiple people in rooms, multiple people on ventilators, multiple people we couldn't do anything for, people in the hospital garage because the hospital was overflowing, and morgue trucks outside. So pretty much every experience that people read about in the pandemic pretty much happened to me. I was treating my colleagues. Our respiratory therapist was on a ventilator. I had friends and family and friends of friends and friends of friends and family reaching out to me to help them. And then it was my own family and my own personal self at risk also, and terrified. So it was traumatic for me. And I ended up becoming really burnt out. And I didn't want to do infectious disease anymore. And that was a field that I loved. Like, I loved it so much. But the pandemic really just hammered me. Like, one of my roles at the hospital here in Denver was, it was my job to determine whether or not someone had coronavirus. I had to evaluate the client, all virtually, right? Evaluate the client, look at all the labs, look at all the data and the testing, and determine, yes, that person likely doesn't have coronavirus or could have it. And so if I moved someone with coronavirus to a non-coronavirus unit, then I risk getting all those people sick. And so it's not just, a test that says you're positive or negative. We got false negatives all the time. So that was very challenging and stressful, to say the least. And then I ended up reading a lot about psychedelics, and remembering my fond experiences as a teenager with LSD. And I really credit LSD a lot in the way that I think, honestly, and that I'm traditionally an outside of the box thinker. And I think that helped me also as a physician, because as physicians, we try to just put everything in this little box. But sometimes when something doesn't fit in the box, that's like your telltale sign that you don't have the right diagnosis. And so while I was doing psychedelics recreationally, I think it really informed a lot of my thought processing. And I didn't even know it really then. And then, so I was reading a lot about psychedelics. I was getting totally burnt out in infectious disease, and the pandemic was kind of slowing down. And I was like, I just need something different. I have to get out of this field. And so I learned about a program in Boulder that was doing psychedelic assisted therapy training. And it was really expensive. But it turns out the COVID consulting practice is incredibly lucrative, right? It's a pandemic, and you're an infectious disease specialist that's doing testing. And I also, every time someone was positive, I called them. So it was very rare in the pandemic to speak to an infectious disease doctor on the phone when you got your first diagnosis of coronavirus, right? So I ended up paying over, I think, $7,000 for this year-long training course in psychedelic assisted therapy. So they teach you ketamine, MDMA, and psilocybin.
Was this tied in with CU, or was it just?
No, this was an independent practice. An independent group. So that was like, it was one of the first, I was in the first cohort.
Oh, okay.
And so there were mostly therapists, right? And I wasn't a therapist. I did some mental health training in my residency, but wasn't a therapist.
Right.
And so around the same time that was starting, my little brother told me that he was going to go to an ayahuasca retreat in Costa Rica, that his friend went, and his friend had an incredible healing experience there, life-changing. And it really piqued my interest. And I didn't really know anything about it other than it was healing, and it could be challenging. So my brother went, and then shortly after that, he came back and explained to the whole family that this was the most healing thing he'd ever done for himself. And he does a lot of work on himself. And so then my father went in his 60s, and my father had never done any psychedelics whatsoever, and decides to go down to an ayahuasca retreat, also in the pandemic.
Wow.
So then he comes back, and while he was there, my dad's the CEO of a international company. He was a guy who yelled a lot and wasn't the most gentle, sweet guy. Like, I always knew my dad loved me and would be there for me, but he was rough, right?
Yeah.
You go to his office and you'd hear him screaming at somebody. Sometimes that was my little brother. And then he called me from the ayahuasca retreat, and he's laying in this hammock. He's wearing his sunglasses, and he has an ankh chain around his neck. And that was not my dad, I'm like, and then he starts telling me about his experience and about how my mother showed up for him in this journey. And they were divorced since I was 14 years old. And he's crying. I never saw my dad cry. crying to me about how he felt with the divorce and how he wants to, reconnect and reach out to my mother and support her more. And he did that after this experience. And it changed my father in ways that I never thought would be possible. Right? Like just a softening of someone. And he didn't like fly off the handle and scream anymore. It was like a completely different person. And so I was, kind of knowing like, okay, I'm going. And I didn't even know what I needed to go for. I just kind of knew that I needed to go.
Yeah.
And so I went there, and I didn't have much in the way of preparation. And I only know this in retrospect after being in this space for so long, and the importance of that preparation. And the first night of ceremony, I was really sidelined, really, I battled the medicine, the medicine part of me, the doctor part of me was battling the doctor that is Mother Ayahuasca. And I called her La Doctora in this ceremony. And the medicine would come up against the doctor in my body. Because, a lot of times ayahuasca can be this diagnostician, right? It goes through your body and it kind of finds a spot that it needs to work on. And I was so confident, like my whole personality was my doctor self. And there was just a literal battle. And then till finally it wasn't. And my ego was literally army crawling across that floor of the Maloka in just this big battle. And then finally I lost that. And the amount of healing and the amount of experiences that I had over 4 nights of ceremony. I mean, after that first excruciatingly brutal night, I didn't want to do it again. I had like physical pain in my chest from being so contracted, and I was miserable and vomiting and all the things. And, I thought because I didn't have the appropriate preparation, I thought something was wrong. I have 3 children. I was convinced I was going to die. How pathetic I was, how sick I was, looking at all these other people vomiting and having diarrhea. And I was like, this is so pathetic, saying this to myself in this journey. And then afterwards, when you sit in what we call the ceremony in the next morning, and you hear the transformative experiences that everyone else had. And I'm listening to these people, and they went back to Mother Africa and like the creation and we're healing childhood wounds and all this stuff. And I was like, that didn't happen to me. I had real, true journey envy. I was like, what? And then I shared my story. I was like, this is really wonderful that you all had this experience, but like, this is what happened to me. I literally felt like I was in a toilet for most of the night. And something in me allowed me to go back the next night. And I overheard people in the pool talking, and someone who had been there before, and he was talking to someone else. He said, when you have such a rough time, it's really important to go to the medicine with the intention of show me how to trust you, right? Because I didn't trust anyone or anything besides modern medicine at that time, right? So, I mean, Anthony Fauci to me was knew everything, couldn't do anything wrong. I literally had posters of him on the walls of my clinic facing outside. It was highly controversial at that time in my life. I showed up at this ayahuasca retreat wearing a vaxxed hat. And come to find out that it's a very interesting thing to coming from a totally Western infectious disease mindset and then going into a plant medicine healing space where most of them are against vaccines, and there's this like massive clash there. And then I slowly started to realize that it's probably inflammatory for me to wear this hat at this place. And so I only wore it for the first day and then no more. I've never worn it again, actually, after that. Doesn't mean I'm an anti-vaxxer. I believe in certain vaccines at certain times. But yeah, so I left that experience. I mean, I had so many amazing experiences over the course of that week. And, we were chatting briefly earlier about physiological, when the medicine addresses physiological conditions and things like that. I had more of the medicine can sometimes do this is very particular to ayahuasca. where the medicine does a soul surgery, we call it, a surgery at the level of your soul. And I had heard about this and I was interested in it, but I wasn't, you never know what's going to happen to you. And so certain surgeons show up in ayahuasca spaces pretty commonly, very specific ones. The praying mantis, Mother Ayahuasca can show up and operate on you as a snake. And minions are also somehow, people see minions quite often in these ceremonies. And also robots can come, and also like these, they look like kind of metallic bugs almost, right? And this sounds totally crazy. And if you told me this before, I would think, if I knew that I would be sitting here talking about this now, I'd be like, she lost her mind. I can't believe that's me, right? It was so, but now like when I go to a doctor's office and they ask me what kind of surgery I've had, I kind of want to write down that I had a surgery at the level of my soul by Mother Ayahuasca. Surely someone would try to put me away. But in this surgery, the Mother Ayahuasca often comes in certain traditions. Ayahuasca is female, right? Feminine ayahuasca. And oftentimes she comes in the form of a snake. And there, a lot of people have snake-like visions in these journeys. Some other animals also, but snake is pretty consistent with ayahuasca. And so she comes over to my bedside and she does a surgery on me. But the coolest thing is that she respected that I was a physician and she let me assist her in a robotic surgery. So I was at the head of my own body with Mother Ayahuasca, removing my control centers. So my whole life I have spent with such a tight control and grasp on everything, because now that I know in retrospect, something happened to me in my lifetime where I felt completely out of control, right? Whether it was my parents' divorce, near drowning when I was a child, I don't really know. Probably, multifactorial situation. But it became pathological in my life. And so she removed my control centers from my brain. And then we also cracked open my heart and opened up my whole chest and removed this control. And so when I flew down, I always had a fear of flying. I hated flying. And I didn't even have a traumatic experience flying, but I hated it. But when I flew back from that ceremony, I wouldn't say I didn't care about anything. Like I still cared about all the things in my life. But if that plane went down, like I was okay. I was like, it's okay. Everything is just okay. And it was amazing to not, I used to have to take Xanax all the time, numb myself out on a plane and not be functional, right? And as a physician, when you're on Xanax on an airplane and someone needs medical attention, which somehow that's always my luck, where someone needs medical attention when I'm on the plane, it's not really the most amazing kosher thing to do to be on Xanax and trying to help someone from a medical perspective. So that was just one way, and that helped me. That was the first way that I saw it start to shift something in my life. And then I came back, and the way that I interacted with my children was completely different. Like when I grew up and I wanted to start an activity like karate, guitar, whatever it was, my mom just said, if I want to quit, she would just say, okay. Like there was never really like a conversation of, you started something, you shouldn't quit. Like, why do you want to all these things? And so I went the total opposite direction, right? This like pendulum swing. And I never let my kids quit anything, no matter how much they hated it. And I remembered very clearly driving my daughter down to ballet, a 30-minute drive to like the top ballet center in Denver. She was a real amazing ballerina. And then she started to hate it because kids were calling her fat, and then she didn't like the teacher and she didn't like it. And then finally one day I'm driving her down there and I'm like, what am I doing? Turned around and took her for ice cream. And I was like, we never have to go back there again. Like, I'm so sorry. It was more like a ability to hear my children and like feel what they were saying instead of me having my own agenda and pushing my own agenda. So that was really great. And also this, like I had a really big download about, when we're raising kids, a lot of us do timeout, right? I remember when my kids would have a tantrum, I would put them outside I put them outside and I say, when you're done, you can come back in. But like, how crazy backwards is that, right? Where we're showing our children, not only is that emotion not okay, but you have to do that alone, right? And I'm not going to hold you, and I'm not going to tell you that it's okay. You're just going to have a timeout and you're going to sit outside.
Right.
I don't do that. I don't do that anymore. It's like, you know, I mean, it's just such a, it just helps in so many different ways. And for some people, it can be really dysregulating. And for some people, it can be harmful, especially if you're in a place that has 100 people in ceremony, right? You've got 100 people in ceremony and there's not enough people to help you. And if you're out of control, they will hog tie you to a mattress. That's what they do. If there's not enough people to help, you get restrained. So that in itself can create a ton of trauma for people. And so a lot of people don't really know to even ask that about an ayahuasca healing center or any other medicine healing center, right? Well, what happens if you don't have enough people to support and I'm out of control? So yeah, I've learned a lot by being in different places and seeing different things. And I prefer to be in small ceremony, just small group. I think it's much easier for the taita or the shaman to control that space and all the energy and everything. And also, for the most part, we drink ayahuasca in the dark, you know? So how are you going to keep an eye on 100 people? And they're allowed to leave the maloka and go outside. And there's the jungle right there, the jungle. Right. So
it can a lot of questions.
Yeah.
I'll start where you left off, right there. Why is ayahuasca traditionally, I'm assuming is traditionally done at night? Clients I've had, they've done it at night, but why is that? Do you know?
I think it's also culturally. So some cultures will do it in the daytime, but most do it at night. There are some medicines that are just traditionally done in the night. There's a medicine, not a lot of people know about this medicine, but in Colombia, before we drink yahe, which is Colombian ayahuasca, you wake up at about 4 a.m. and you go to the river with your group. And the taita serves you a medicine called achapo. And achapo is a medicine that can only be drank in the dark. It's tradition. It's like they believe that certain plants have more activity and at certain times of the day. And so this medicine is exclusively a purgative. So there's no psychoactivity whatsoever. You drink 7 glasses of this, and it doesn't taste like yahe. It doesn't taste like ayahuasca. It's much more tolerable. You drink 7 glasses and then followed by a lot of water. And then you're just vomiting into the river. And so it's actually nice for many reasons, because it's a cleaning. So it cleans you right before you meet the medicine. And it's kind of like an icebreaker, right, for your group, because before you go into the ceremony and you're vomiting, then you're also in a non-ordinary state. So it's a whole nother level of like surrender. So It's like a step towards that experience that also helps to prepare people for that. It's not a lot of traditions do that. I've never seen it done before outside of Colombia.
Okay. This is a couple part question. Why do you think, or is it possible to extract the benefits of psychedelics? And I know there's a lot, and maybe we should back up. How would you define psychedelics, obviously, as a physician now, and how would you explain what psychedelics are and aren't, just to a random person that's maybe has no understanding of psychedelics other than what culture has said, which is, LSD, bad, what would you say?
Yeah. So psychedelics, I mean, the word means mind manifesting. So to me, there's a whole group where you have the classic hallucinogens like LSD, psilocybin, ayahuasca, iboga, DMT, and there are probably some other ones that I'm not saying. Peyote, right, mescaline. And then you have the pharmaceuticals, right? Ketamine, many people think that ketamine is not a psychedelic. It's not a classic hallucinogen, but it is surely mind manifesting and is so similar in the messaging, in the experience to the classic hallucinogens. But ketamine is a dissociative medicine. So it oftentimes makes people feel very disconnected or outside of their body, which is not typical for the classic hallucinogens. Okay. And at a certain dose, MDMA is mind manifesting. People have visuals on MDMA. So what I would say is that a lot of these substances have benefit, right? And they will be rescheduled, because to be Schedule 1, it has to have no medicinal benefit. And there are tons of clinical trials that are proving that wrong for LSD, for psilocybin, for MDMA, for all of these things. And so it's only a matter of time before they get rescheduled. And luckily, in this administration, this is not a partisan issue like COVID, right? Like I don't have to battle, what your political views are. Like the right and the left both appreciate psychedelics and see the benefits. So it's so much easier in that respect, right?
You said psychedelics, correct me if I'm wrong, is basically is mind. What did you say?
Manifesting, yeah.
Tease that out. What does that mean? That's a big word.
So a lot of it, so for a lot of the psychedelics, you have visuals, you have hallucination, right? You see things. And it's also, you have deep, introspective, reflective insight, right? These medicine, when you're in an appropriate healing container, right? You can take psilocybin and have it at a concert, or you can have psilocybin in a healing environment and have a wildly different experience, right? These medicines are very sensitive to the environment in which they are taken and the respect and reverence they are given, right? So when you have these medicines in a healing environment, they are often trauma-seeking missiles, right? They will take you to your darkest moment when it feels like you're ready to go there. Because some of us, right, we can be doing psychedelics I've been working with psychedelics for 5 years and still haven't touched very specific traumas that I know I have, right? And so I believe that it takes time, and it's when the medicine feels like I'm ready to go there, and when my system is ready to look at that thing, right? So, but what people often don't understand and don't realize is that you can have a trauma-seeking missile experience when you're at a concert, right? So, and then people call that a bad trip, right? But it's not the medicine. It's you taking the medicine to that environment and not respecting that could happen there.
I asked Lindsay this same question because this comes up and has come up for the last 8 years that I've been connected to clients seeking psychedelic assisted therapy. In your estimation or idea, right? People, and you've said it before, the medicine almost like it has a personality. It is an entity. Now this gets into faith and religion, and there's multiple layers here. Something I'm very interested in because, one, I work in that space, but also I teach, and my clients, my students are super interested in being able to parse some of this stuff out. So for you, why do you associate it as an entity, or do you associate it as an entity? And if you do, if it is a person or a deity, like, can you tease that out a little bit?
Yeah. I think that the plants have a spirit, and the fungal medicine have a spirit and an essence. And I believe that they are the teachers. They are the guides. When we talk about guiding a psychedelic experience, I don't believe in that. I don't believe that as facilitators, that is our role.
Okay.
It is the client and the medicine is the teacher. When people meet a new medicine for the first time, it is my belief that they should introduce themselves. I'm Dana Lerman. My birth parents are so-and-so and so-and-so. And this is why I'm coming to you. Can you help me with this? Right? And establish a relationship, right? Because otherwise we're just exploiting it like we've exploited tobacco and coca and all of these sacred plants and sacred medicines, like we believe that those medicines have a spirit, right? We call abuelo tobacco, right? And mama coca, right? But look at what happened to them. And now cigarettes are completely adulterated, tons of chemicals. And in indigenous tradition, they don't inhale tobacco. They don't believe to take the spirit into the lungs and trap it in there, right? They work with it. Most of us use it, right? And then we have lost like all connection to our whole plant spirit kingdom. And some people don't believe in that stuff. Some people are like, yeah, I want to go do a psilocybin journey because I'm going to use it as a tool to heal my trauma. And they'll probably get some benefit from that. But like when you establish the relationship and you're in right relationship and you honor the lineage of where these medicines came from, pretty confident you're going to go much deeper and have a much different kind of relationship and experience.
Is it possible, Lindsay and I were discussing this, and maybe it was somebody else, I may be confusing conversation. Is it possible that that entity is really yourself just on the drugs or on the medicine, in that, you know, obviously you're ingesting something that's changing your psychopharmacology to a point where you could be having a conversation, right, with yourself. You could be having a conversation with some sort of deity. You could be having a conversation with like the deity, like if you believe a lot of Western thought or even Eastern thought that there is a universal God. And it sounds like your view is it has a personality, or it has a purpose, and it has an idea of what it wants to do, but it wants to work in tandem with you if possible. But
I think it's everyone's own personal belief of what it is that they're engaging with, right? Like some people, and I totally support some people believing what you just said, right? Like, oh, I'm on a psychedelic. This medicine is making me think that I'm having a conversation with someone, but it's really just me in my mind and this substance that I took.
Yeah.
I think that when you work with it to a certain extent, I don't know anyone that works with ayahuasca or plant medicine and has really worked with those medicines that they don't believe that that is an entity and a spirit. I don't know anyone.
Do you think that that's a result of, so the vast majority of individuals in the Western world that I've talked to, a lot of them connected to the special operations community, some of them not, some on here, but some obviously offline as well. Do you think that that is a result of the vast majority of them learning from Central and South American indigenous people, and so just that lineage is being passed down of like, this is their worldview, this is what they think about it, and that there's other individuals around the world that maybe approach it differently?
I think that's possible. However, many of the places where you go and you sit with ayahuasca, they're not telling you about what they think it is. They're not telling you that this is an essence and a spirit. They're not telling you anything. Sometimes there's not a lot of preparation and you just go and sit with the medicine, and then they'll meet with you beforehand and ask you, why are you coming to this? What's your intention? But they're not talking to you about what they think the medicine is.
Right.
So, there's not a lot of, I don't want to say brainwashing, but like bias being, infiltrated into that area.
No, my question comes because as a provider, and this is something I've seen with my clients, and I think all of this has got to get, this is why I want to have these conversations, is I think it's got to get not washed out, wrong verbiage. It has to be discussed. And I think there has to be, hopefully furthering discussion to, one, understand, to educate, but also create options. Is if we're taking what the indigenous people taught us and replicating it in ceremony, from an academic standpoint, from a faith standpoint, I think there's room for a discussion of like, hey, this is a worldview, and this is what people believe about these medicines, and I'm going to replicate that in ceremony. Whereas like you're discussing, then there's individuals that say, hey, you know, Catholic, and I'm just here to get the medicinal purposes of these plants, and I don't really want the worldview infused. And then there's probably a third option where there's probably a mixture of the two. As clinicians, right, we get stuck in this weird place where sometimes clients are, you know, I'm a hardcore Catholic, but because of my post-traumatic stress, TBI, like I want to go, but the coaches are telling me it's grandmother earth, and I'm having to try and navigate this space where I'm going to get pursuing to get healing, but at the same time, this doesn't align with what I view.
Totally.
And so as a clinician, sometimes, and to your point, there's so many different clinics and people doing this. It's the wild, wild west. I'm curious from your vantage point, like what do you recommend clients, whether they're working with a clinician, or obviously the vast majority of them are working with the coaches that are a part of the ceremonies or sending them. How do you help them like navigate that space? And is there a good or bad? Like, I'm curious to your approach.
I think what I would suggest people do is you really want to know who you're sitting with and ask them what their beliefs are. And if they're in alignment with you, then you go. And if not, then you don't, right? And you keep searching for who your people are, right? There are rabbis that are serving psilocybin. There is everything that you can think of, you know, more medical, right? Look at the clinical research space, right? Clinical research space, there's no, you can't have any kind of deities or anything around in the room, and you can't hug someone in a journal. Like there's a whole slew of different ways to have these experiences. And I think that regardless of whether or not you care of what the facilitator's views are, I think it's important to just educate yourself. Just, you know, ask as many questions as you possibly can.
Yeah. On that note, and I appreciate that. Yeah, you noting the clinical trials. Yeah, I was going to get trained via MAPS back before COVID happened. And one of the things that I was looking at is they always had a male female because they always wanted accountability, because obviously somebody's under the influence of a medicine. But what are some of the indicators, right? So as a clinician, we're not medical doctors. We know, you know, fill up a thimble full of information on the medical end, but obviously similar to like law, we ethically try and steer clear of any of those conversations with our clients, but it comes up. As a physician, what are you looking for as indicators, and what do you suggest? Obviously, there's different ceremonies or treatments. We've been talking about ayahuasca, but then there's ibogaine and 5-MeO-DMT. And more. What do you recommend? I'm a client, or my client's coming to you and saying, Dana, I want to go. What are you looking for medically as potentially indicators that they're not physically fit for a ceremony?
Yeah. So a lot of my work in this space is around harm reduction.
Okay.
I think that is probably the most important thing, because as a physician, we first do no harm. Right. So in terms of medical or psychiatric contraindications, first of all, as a physician, you can't legally go and tell someone to do a psychedelic medicine, or you can't recommend a psychedelic medicine. It's more of your client comes to you and says, I'm interested in this. And then you can help them in terms of harm reduction, right? Where are you thinking of going? Who's the facilitator? What do you know about this place? Have they done a medical intake? Do they know your medical history? Are you on certain medications that could hurt you, right? If you're on SSRIs or other kind of psychiatric meds and you take ayahuasca, you have a high likelihood of having serotonin syndrome and potentially dying. That's not a joke. And people lie on their intake forms. And this particular medicine, not an iboga, you really don't, first of all, you don't ever want to lie on medical intake, but those two medicines, you could really get hurt.
Yeah.
And
can we pause just there for a second? I want you to reiterate that just for a second, because there's so many clients specifically in our community with special operations where they're used to, you know, a certain extent cutting corners, but, and then there's also a lot of noise. And I talked about this with, Lindsay, I think there's been there has to have been so much positive noise to outweigh the negative from the 60s and the 70s culturally, that there's not enough experts like yourself talking about no, people can die from this. And so yeah, if you could pound that beat that horse a little bit longer of just like
yeah, for sure. I mean, I would be brutally honest in your medical intake form with all of the medical history that you have, and your psychiatric history, right? And your family history. Because if you have a first degree relative with schizophrenia or psychosis, you're at an increased risk of having that. I have seen psychotic breaks in ayahuasca ceremonies. I have seen that. And it is scary, right? And so if you're going to a ceremony space and they are not screening you and they are not asking you your medical history, the medications that you take, your psychiatric history, whether or not you're suicidal, right? That's also suicidality and psilocybin. Jury's still really out on that, right? Because psilocybin is the amplifier. Like of all the psychedelics, psilocybin is this grandfather amplifier, right? And it can amplify any of the things you have going on in your life. So if you have suicidality, my practice is I would refer that person to ketamine 10 times out of 10. Because ketamine is the medicine that is known to help with that. And it is, in my opinion, should be a first line for people struggling with suicidality. And part of the reason why I went into this space is because my best friend, who's a radiation oncologist, struggled with tons of mental health issues over the course of his life, was on every different antidepressant, had chronic low back pain, got to a point where he was suicidal, wrote me a suicide letter. And then we, in conjunction with his psychiatrist, tapered him down off of all of his antidepressants and treated him with ketamine. And you don't have to taper down on your antidepressants for ketamine. That's one of the great things about it. It doesn't work on serotonin. So you can stay on that medicine. You can stay on your antidepressants and still get benefits from ketamine. But he wanted to come off of it because it wasn't helping him. And so after his fourth dose of ketamine, he no longer had suicidality. That was 5 years ago. And ketamine, you don't take ketamine every day. It doesn't have all of the awful side effects, decreased libido. I mean, a family member of mine had lockjaw from Lexapro. Like, and most of these people, it doesn't work anyway, right? It helps 30% of, and what happens is people are going through a traumatic time. They get put on antidepressants. They're feeling better and no one takes them off. Right. And then they just are staying on them. And then when that person wants to do psilocybin, it doesn't work. They have a blunted experience, right? You can have someone on SSRIs and someone not on SSRIs. They're in the same journey together. Both take 5 grams. And the person on SSRIs either doesn't feel it at all or has a blunted experience and has to take much, much more. And what's the safe amount of much, much more? No one really knows. So, yeah, I mean, psychedelics are about root healing and uncovering the stuff that is stuck inside of you. And antidepressants are about getting your serotonin up, helping you in chemically, but they don't allow you to go in there, right? It keeps you in this window. To me, in my honest opinion, at some point there needs to be a black box warning on SSRIs that people are not going to be able to have true psychedelic healing because their experience is going to be blunted by these SSRIs.
On the harm reduction side, what do you think is the most under-discussed piece at this point in time?
Under-discussed piece in terms of harm reduction. I think that there's a lot. I think there's a lot of winging it that's happening. A lot of underground providers don't know about medical histories, don't know about contraindicated meds. And there are now some apps that are coming online that you can, a lot of people just chat GPT. And that could be, I wouldn't want to sit with someone who's just chat GPTing my care, right? I would want someone who's critically thinking. ChatGPT is also phenomenal and can help, but I would want someone who's critically thinking. ChatGPT is also not looking at the person and talking to the person, right? So I think also the what was I going to say? So it's that intake stuff that I think, and also consent, right? And so we always talk about informed consent, right? You're going to go for a C-section. You can have bleeding, you can have infection, you could die, you could have blood clot, this and that, right? But in psychedelics, how do you give informed consent, really? You have to tell someone that you can go. It's like, the way I think about psychedelics, it's like it's an emergency room for the soul, right? And the facilitators are like trauma doulas, basically, right? And they're there to catch these traumas and to be there while they're being birthed, right? But you have to be able to tell someone that this experience can be the most euphoric experience of your entire life. You can, connect with your ancestors. You can see your children when they're older. You can talk to loved ones who have died, all these things, right? But you can also go to a very traumatic time in your life. You can also have an ego death or ego dissolution, which may be the most euphoric experience of your life, or it may be the darkest experience where you're dying for hours. You may not be able to talk to me, right? You may not be able to move your body. You may be paralyzed, right? And you may not hear me when I'm trying to help you, right? And so you have to really tell people this, because they have to know what they're getting involved in. And you also have to tell them, you will never be the same. You're not going to look at things the same way again. So you have to know and really consent to that. Right. And so I think that we shouldn't try to scare people out of it, but you have to be honest, because if you don't tell them about an ego dissolution, or you don't tell them that they may witness their children die. Right. And then how do you tell them? You can't tell them every possible thing that can happen, but you got to give them the arc of what is possible here.
This may be, you may have the same answer, but in our community, and I would say in general, maybe across the board, there seems to be it's almost a rite of passage, right? So the military member wraps up a career, or is wrapping up a career, good, bad, or indifferent. I've had clients that have come to me and say, I think I need to do psychedelics. And my first question is what makes you decide that? But because everybody, or a large portion of individuals within this community, are pursuing psychedelics, I guess my question is how do we push back against this narrative that you have to do that for healing?
You don't.
Okay.
There's many other things that people could do, and it's not for everyone. And I think that if people are not sure, then that means they don't do it. Right? Or they educate themselves and they learn more. You don't go to this kind of experience unless you're really sure that that's where you're supposed to be. And, people can get to non-ordinary states of consciousness also without doing psychedelics, right? Deep meditation, breath work. There's a lot of other things. And people can do EMDR and somatic experiencing and internal family systems therapy. There's a ton of stuff that people could do. Psychedelics is ordeal. These are ordeals. We call them ordeal medicines. It is a big experience. And, when you talk about 25 years, 50 years of therapy in, a few ceremonies, you got to imagine you're not just bypassing all your stuff. You're actually looking at all that. Right. So it's not, yeah. And so it's not, this is not a joke. This is very serious and also can be very hard.
Yeah, that's a good point. I think people obviously, whether it's just their natural tendency to just say, yeah, it was bad, but here's all the good, and focus on the good, right? We talk about, past experiences very similarly as humans. We remember, yes, it was hard, but really we highlight on all the good things. But being a clinician and also a physician, obviously you're more in this space than I am, but hearing some of the pain and emotional and physical during hour-long ceremonies and treatments, I think people are remiss or need to hear that message that no, this is still very much the deep end, so to speak. And it is, I talk about it, it's exposure therapy, just you're not in control to a certain extent. I have heard, along with yourself and a lot of clients, the discussion of working with the medicine, having discussions about where they go and having intentions of wanting to heal different things. But to a lesser degree, there is a sense of being out of control, in the sense of the medicine, if we're going to use that language, is going to show you things that you may not be ready for and or comfortable. So it sounds like I'm hearing you say, hey, if I can kind of stop and summarize a little bit, this was not your path. This was something that I wanted to circle back, and I did want to ask this. How much did your dad's experience influence you in going?
I was going to go regardless.
Okay.
I would say we're a very close family. So I mean, it gave me the, like my brother went and then my dad went. And so it kind of gave me a little bit of safety around it. And they both had these transformative experiences. So I was not as scared to go. But I also had no idea. Because when you hear, one person, two person, even five people's experiences, right? Those are just their experiences. Like there's infinite amounts of iterations of experiences, right? Like, and no two experiences are the same. So, we have a general idea, right, of like things that can happen in ayahuasca ceremony, right? The soul surgery, the consulta, where someone, a being or something, comes and has literally a consultation with you, right? You can have the purge. We know that that's pretty common on ayahuasca, where sometimes it's coming out of both ends at the same time, right? And then, the different purges that, the yawning, the crying, the laughing, all of it. And so, and then the nada, right? When someone goes and has a medicine experience and doesn't feel a medicine at all, just goes to sleep. So we know that there's like these different places, but then outside of that is just endless.
How would you help somebody determine whether it's right for them? Obviously, it's an emerging therapy. It's been around for a tremendous amount of time. Psychedelics have been, and in the medicinal space, specifically with indigenous populations, but here in the West, it's emerging therapy. How would you recommend, or do you recommend? I know you don't recommend, but how would you help somebody sort that out if they're on the fence?
So I think that if people don't have a medical or psychiatric contraindication, right? And in psychedelics, we say that, people say this, that they feel a medicine calling them. Like this particular medicine keeps showing up in their life. And I'm not talking about Instagram because your microphone's on and it heard you and it's like giving you ayahuasca retreats. Like, I know someone who had been thinking about psilocybin ceremony and then it just kept showing up for her. Like mushrooms everywhere and people talking about it. And then, it's like this call that people feel, and so I think that if anyone has hesitancy whatsoever, don't go, because you're not trusting it. And if you show up and you don't trust it, you're going to have a much harder experience. And educate yourself before you decide, right? Like if you're not sure, it's probably because you don't know enough. Right? Like if if you're someone who absolutely hates to vomit, right? Then you're probably not going to drink ayahuasca, right? I know plenty of people who just don't want to do it because of the vomiting.
Hmm.
So people, there's some sort of the call that people feel.
I had a question. I'll come back to it. It's in there. It's on the tip of my tongue.
No worries.
So your brother did it, your dad did it, you experienced it. It obviously came at this formative time in your life where it was the tail end of COVID. You'd maybe seen some holes in modern medicine or science, and I'm not trying to get into your views, but I'm just kind of reflecting what I'm hearing you kind of experienced. And it sounds like this has been a foundational shift, both personally, but more so, well, maybe more so personally, but personally and professionally, of where you went since then. What's the biggest thing or the most surprising thing, good or bad, since you entered this space of, now being a consultant, but also owning a company that works in this space?
I would say before I started working with psychedelics, I had not 1 ounce of spirituality in my entire body. I believed that when you died, no afterlife, nothing. And I taught my kids that. And now I'm like backpedaling all of that. And my kids have grown up in a world of, we're in Colorado. Psychedelics are decriminalized here. So they have a completely different viewpoint, right? They would never call them drugs, and they know not to go near them, right? They have a very deep respect for that kind of work. And I share with the kids like what happens in those ceremonies. And, they really, I think it's important that we teach the kids that too, right? Like that, these medicines are ancient, and then our government decided to make them illegal. And many of them are plants that are on this earth, right? And like, if you think about how divine the human body is and how we can heal ourselves from so many things, but for some reason, when we're traumatized, that gets locked in our body, right? It's like the only human design flaw that I could think of. But because I'm a spiritual person, I also believe that however I'm here on this earth is the same way that these medicines are here on this earth, right? And like, if you think about ayahuasca, out of all the plants in the jungle, right, you have to put 2 of them together to get them to be active. How does that happen? How does that happen, right? You've got to cook it, and then you've got to drink it, right? And it's just, it's amazing that these plants are here. And I believe that, just like, look at all of the other plants that are helpful in modern medicine, right? Chemotherapies, some of the chemotherapies, vincristine is from plants, digoxin is from plants, right? Poppies, coca, right? These are all, cocaine is used in modern medicine and in ENT surgeries. So, but these all have plant roots.
You may not want to answer this, and this is, I am directing this question to you, but it's more so, to be fair, let me give you a little bit of my background so that you understand this question. I work at a religious institution, and specifically I'm a counselor educator, and more specifically, we teach how to ethically integrate people's faith. And because we're a religious institution, I would argue we're highly scrutinized to make sure that we are not just teaching from our worldview, but making sure, because when you're working with somebody, they are highly influential because you're the professional. And so we are painstakingly careful to make sure it's client-centered, client-led. One of the things that I've personally wrestled with watching my clients with this but also hearing you say that is, and I'm going to speak in general, so I'm not necessarily speaking to you, but you take somebody that is potentially traumatized or in a suggestive state. We're adding a psychoactive drug. And I've heard the exact same thing for good, right? Mostly for good, in the sense of I had no spirituality, or I was an atheist, or, you know, I walked away from my faith through my military career because I experienced so much death. And now I believe in something again for the first time. As a clinician, that's where I'm like, oh, ethically, like we're crossing lines, we're weird here. As a physician, your guys' ethics may be a little bit different because you're not necessarily counseling people, but do you ever question, and again, I'm asking this kind of in general, but you're here, and so I'm asking you, like, do you think you would have came to that same conclusion about what you believe now from a spiritual standpoint had it not been the plant medicine or the facilitators?
I think that the cultural influence is definitely could be a part of it, right?
Okay.
But I'm also pretty confident that if someone goes and drinks ayahuasca on their own in a white room without any nature or anything, that they'll still find it.
Yeah.
You know, I think it's the medicine.
Okay.
You know, and that's why so many people who do psychedelics on their own still come to that place, right?
Yeah.
People who go and eat mushrooms with their friends in the field and like feel connected to the whole universe and the plants and the earth, and that's like a very common thing. And there's no shaman there telling them that, you know, this medicine is from the earth and it's a plant being and a spirit and an essence and a sacred reverence and indigenous wisdom. Like, there's no one there saying that, but the medicine is.
Right. No, I 100% agree. And the vast majority of individuals that I've worked with professionally, but then also know personally that have gone, do report very similar, whatever their faith is. You know, even people that were hardcore Catholic, hardcore Christian, hardcore not Muslim, Mormon, atheists, agnostics. There's a very similar sense of a deep appreciation for humanity, a deep connection, and quite literally feeling a connection in and through themselves, but nature, but also those that they're with. And so part of these questions, just so you know, again, self-disclose for you, that way, you know, part of this is, as I'm learning and walking through this and working with clients, my own worldview is going through a filtration process and learning. And so a lot of these questions are definitely from me, but at the same time, I have a lot of students that watch as well. And so we have some of these discussions, and I don't know, like, what is it? What is it not? You know, and trying to not wrestle with it, because I don't think it's an academic exercise that we wrestle with per se, but I think it's so new that the questions abound. And so whenever I get somebody like yourself that has much more experience and expertise in it, like, I'm thirsty to just pick your brain and push into different places. So I hope that gives a little bit of background of my curiosity.
For sure. I get it.
Okay. So this has changed you. It's, which I think, again, is a testament to, at the very least, how powerful these drugs are, medicines are, that somebody could have not, I don't know how you would describe it. I would say in no faith in the traditional sense, but now you have a faith on the other side of it. You may not describe it that way, and you correct me if I'm wrong. I think that that's incredibly powerful, but also, I would argue personally hopeful, because I really see the human being, and again, from my discipline, we look at the biopsychosocial and of course the spiritual. And I think so much of maybe the last 100 years, specifically in my field and in some of your field, has cut off spiritual. And we've just relegated to, hey, if you have questions about that, go talk to a priest, go talk to a pastor, go talk to your clergy, because we're just going to, cut everything else out and only deal in this area.
Yeah.
Which is not the human being, right? I mean, we're multifaceted and we have all those parts. And so shouldn't our treatments and shouldn't what we work with be integrated in that capacity?
And holistic.
Yes. Very holistic.
Yeah. And, every doctor and every therapist doesn't have to be a psychedelic expert, but I believe it's our duty to educate ourselves, right? So, there's so many doctors that don't want to even open the door, don't even want to know about it, right? And then there are so many doctors who are drinking ayahuasca.
Right. What do you think, on that note, how do we move that forward? And while you're thinking about that, I'll share as well. So we've got providers in the SOF Network that literally are doing treatment, ceremonies on the regular. We've got providers that are doing research, clinical research. And then we've got providers that are like, I'm not bought in. I want to wait a couple of years and see what comes out in the wash, and everywhere in between. And that's just in our 110 plus provider little ecosystem. But coming from a more traditional Christian faith background, I've even pushed with some of my colleagues to get into some of a couple of national conferences and have these discussions. And one, we got accepted into this last year. And then as we were preparing, one of the panel members that was kind of on the other side, if you will, basically pulled the plug and was like, I'm not getting on stage with you guys because this is irresponsible. And so I share that to say, like, as much as you and I know this is like an exploding topic and so many people are talking about it, there's a humongous portion of the population that want nothing to do with this. And you've even mentioned it from a medical standpoint. So how do we further the conversation from your perspective?
I think it's about destigmatizing, right? And education. I mean, you can lead a horse to water, but right? Like, you can't make them drink. You can't make someone do something, right? And I mean, hopefully at some point, this is a part of medical school curriculum and therapist training, and this is mandatory work, but, to at least educate themselves, right? But you will never know what it's like unless you do it. And to stand on a podium and to say that this is wrong, or this is, we shouldn't be doing this or exploring this, or without having done it, you have no right. You have no right, right? When there's plenty of data to support it. And doctors are always saying evidence-based medicine. I mean, at Mount Sinai Hospital, it was drilled in my brain, evidence-based medicine, evidence-based medicine. We don't do anything unless there's evidence. There's evidence, right?
Yeah. Also, and I know in the medical field, it's a little bit more stringent, but one of the things that we talk about, and I think COVID highlighted as well, is if we live in that box, which I get why they created that box, but as clinicians, and I'm going to lump in medical providers and psychotherapists in the same box, we are caught between what's working with our clients and the research, but the research is always behind. And if we're ethically not figuring out what works and potentially facilitating that and helping navigate our clients in that space, then to your point, we could be doing harm. And I don't think we're being honest to what our profession has really called us to be, which is that guide, that service or servant that is caught between those two worlds, but willing to go and work with our clients when they're pursuing alternative medicines, if there is at the very least anecdotal evidence that this is extremely helpful. Now, to your point, the evidence from a academic and journal article research, clinical research is coming out almost monthly at this point in this area. what do you think it's going to take for those individuals beyond exposure for some of those people to at least get to a point where they're willing to engage in a conversation?
I think when they start hearing more about how their friends and family are doing it, like because it's one thing to read about it, and they have to actively seek out the data. And if they don't want to do that, then it comes down to people in their life who have experienced, these medicines, plants, like, because it keeps happening where someone in your family went and drank ayahuasca and then all of a sudden they are a completely transformed person. And sometimes, the transformation is not what they want, right? Like my little sister, when she saw me come back from having an experience and she saw the rapid change in me. I mean, I didn't have like I have a whole journey arm here. My sister's like, no one in my family has tattoo. But like, and that can be scary to people. They're like, oh, well, my life's like, okay. Like I know I have some stuff and I'll deal with it at some point, but like, I'm scared because I don't know what I'm going to be like afterwards. Right. So it's scary for some people.
Yeah,
totally. And there's a lot of fear.
Just for clarification, Dan is not, and forgive me because I just met you, but she's not the hippie that became a doctor. She was the straight-laced, very tightly controlled, performed medicine at Mount Sinai Hospital in New York, and then through COVID and your exploration has, speaking very relative, but like loosened up and has begun to explore other alternative medicines, hence the tattoos, and obviously the transformation, like you mentioned, your parenting and so on and so forth, which I think is another just testament. And this is part of the reason I wanted to interview you, along with the other individuals on this, is as human beings, if we're not maturing, if we're not evolving. Evolving. Thanks for words out of my mouth. Obviously we're doing a disservice, but specifically as clinicians, as medical providers, it's a huge part of what we do. And I couldn't help but, I would say correlate a part of who we are, as helpers. Mm-hmm. And so that there is a natural transition, right? If we're not growing, if we're not stretching, if we're not maturing, even suffering, right? Because that's a part of that transformation process as well.
Totally. Yeah. I mean, if we're not evolving, then our species doesn't evolve. Like, what are we teaching our children? If I'm the same as my parents, like what, or you know what I mean? If I'm like, we're trying to move forward.
Right.
Right. We're trying to look at things differently, reframe things. Because if I'm just looking through the lens of my father or my mother, then my kids are just going to be mini me. Like, I don't know. Like what?
Yeah. No, I completely agree. Okay. So we've hit on, is there argument from a medical standpoint beyond individuals that have biological markers of blood relatives that have had schizophrenia or a psychotic break? Are there any other biological markers where individuals need to steer clear? And or if they're not working with like a consulting group, well, I probably should have stopped and clarified. Is this a part of what you do, is harm reduction? So if a client that I have that wants to go, I connect them with you and you go through. Can you just walk through what you typically do with that client if I were to hand them off to you?
Yeah, for sure. So I would ask them what medicine they're exploring, what kind of experience they're exploring, why, where, how do they know about this place? What do they know about this place? And their history of any psychedelic use in the past, right? Have they worked with any psychedelics before? I'd ask them their medical history, every single medical problem. Do you have diabetes? Have you had a stroke, a heart attack, right? Because not a lot of people are thinking about like these psychedelic experiences are a stress test, right? So if you are over 65 years old, have heart disease, have diabetes, have high blood pressure, like you're at increased risk. Maybe you want to get a stress test, kidney disease. Have you ever had a seizure before? Seizure disorders are pretty standard contraindications. I know of a shaman who had someone who had a seizure disorder in their ayahuasca ceremony, and the person had a seizure in the ceremony. Like, that is not ideal, right? And so I'd ask them all the medications that they're taking. I'd ask them, have they been on SSRIs before, and for how long, and when did they come off? Making sure that someone, sometimes what some people are trying to do is like, oh, they really want to fill their ceremony. And they had someone reach out who is on SSRIs, and the ceremony's in a few weeks. And so they'll just have them taper off. Or someone who's been drinking a lot and wants to do a psilocybin ceremony. And you're like, okay, well, you got to stop drinking, give yourself a few weeks, and then we'll do the psilocybin. That's crazy, right? Because these people are being numbed out and are emotionally blunted and are not feeling what humans are feeling. And then you go and give them a medicine. So you take them off, and then all of a sudden they're like raw human, right? And then you give them an amplifier. That could be very dysregulating for people, right? So you want to, make sure that people are leveled out really before they go and are they ready? And then, so going over their medications, there are very few medications that will interact with psilocybin specifically. Lithium is one of them. You can have a seizure. But also, knowing that if someone's on SSRIs, they want to do psilocybin, likely the experience is going to be blunted unless you give them a lot more, and then how much more, right? And then, talking about allergies, obviously someone have an allergy to mushrooms, like that could be a problem. And then their social history, talking about, do they do any drugs? Do they drink? Do they smoke? All of those things you want to know. And also I think in the question about why are you coming to this experience is some people can get addicted to non-ordinary states of consciousness, right? Those are the people that just go on the tour of the medicines. They do the medicine and they don't do anything afterwards. There's no integration. There's no talking. There's nothing. They just go, let's book the next DMT ceremony on the Nile. Do you know what I mean? Because it's a crazy cool experience. But I've seen people get addicted to non-ordinary states, and it's scary.
Because of the legality issue, everything's piecemeal. And for individuals that aren't in this space, I'm going to walk through some of the hurdles that we're currently experiencing. Is if I have a client and they say, hey, I want to go do ibogaine. Great. They may find somebody. Let's just use one of our partners. So Vet Solutions, they want to go down to Mexico and do ibogaine. They have protocols and checks that they go through, but from me, right, as a licensed clinician here in America, I can't recommend ethically, legally psychedelics. It's not legal unless it's a clinical trial, and so the vast majority of these are outside of the United States. Enter coaches. Coaches are individuals with some sort of training-ish that now are working with my client, sometimes in tandem with me, many times not, very separate, where they're preparing them for the treatment and the integration. And the 3 phases are preparation, treatment, and integration, like we've talked about before in this series. And so what we've experienced as a clinician is we hand them off to a coach. Sometimes the coach communicates with us, sometimes not. They go do the treatment. They're continuing to do coaching a little bit while we're trying to figure out which therapies work best with integration, EMDR, IFS, fill in the blank. And of course, they have to go down to Mexico and there's travel. I say all this and I paint all this picture to say it's a very disjointed. And even though we're approaching it holistically, the process is not.
Totally.
And so, Dana, the question is, in a perfect world, we're marching towards legalization, start to finish. Give me your ideal clinic and or process and how it all works together. Because one of the things I'm trying to do as an organizer of SOF Network is to work with these other nonprofits to fill in some of these gaps. But I'm also looking ahead and knowing there's going to be a legalization at some point, like in Colorado. But give me your perfect start to finish Is it a clinic where everybody's there in a disciplinary? What does it look like? Cast that vision.
Yeah, exactly. So it's a multidisciplinary approach, right? So in the hospital, when we have a complicated patient on chemotherapy or an organ transplant, like we have the oncologist or we have the transplant team with the infectious disease team with the other services that need to be there in this, and we're all talking, right? We have tumor board, we call it, right? So this would be an ideal approach where we meet and discuss these clients, right? And you have the therapist there who knows the mental health background of this person. You have the medically trained person who knows the medications they're on, their medical history, right? And then this is a whole, and then there's a plan, right? Of what, most places aren't going to have like a menu of different psychedelics that you could do. Most of them are like, this is a dedicated psilocybin center or whatnot. And then, they have, they basically all give their opinions and formulate a plan for this person. That is, I think, ideal.
In your consulting, what's just because I've never worked with you personally, and I just learned about you in the last month or so with Lindsay, for providers that are interested in working with you, many of our providers are going to watch this and other providers. What's the process like if I'm a clinician and I connect one of my clients with you? How do you collaborate? Like, what's the process right now with the clinician and you as a consultant? How does it work?
Yeah. So in terms of, are you talking about in terms of harm reduction?
Just practically, just like, do we jump on a phone call? Do we pass emails? And then how do we work collectively with the client?
So what I mainly focus on is ketamine assisted therapy. So I train therapists in ketamine assisted therapy through a online platform that's self-paced, and it's only $200.
Okay.
And so a therapist will, if they're interested, will go online, take the training. Once they do the training, then I get that they've completed the training. They send their insurance, a copy of their insurance and their license. And then they are able to then refer ketamine assisted therapy clients to me. I do the medical intake via telemedicine. And then I will prescribe them ketamine. It gets sent to their home and they have to do it with the therapist. And I also, right after I'm done seeing the client, I send the therapist an email. Thank you for the referral. This is my assessment. This is my plan. And you will see all the dosing of the ketamine. And the client signs paperwork that they're doing it in their therapist office. And if for some reason they don't, then they're discharged from the practice. But I would say that's a pretty rare event. And that's why I do it with the therapist, because it's another, person that is involved, right? Another eye on and a person who's in the journey with these people, right? Because otherwise I don't support at-home ketamine use. I've seen so many things happen with people in journeys where there's big trauma coming and like they need support, they need someone there. And then, from a harm reduction standpoint, people would reach out, they fill out an intake form. They email me and I will meet with them, ask them various questions. And if it is okay with them, then I will share that with their provider.
On the medical support, so two-part question, with your consulting, let's say is the ketamine sent, and I'm assuming you're only working with individuals that, have the capacity to administer the drugs, and it is through an IV, correct?
No, this is sublingual ketamine. So it's an oral ketamine. So there doesn't have to be a medical provider there.
Okay. Interesting. Yeah. So my follow-up question kind of goes back to current ceremonies. So you've got people that are going to Central and South America. As a medical doctor, do you recommend that these ceremonies have a medical staff, and or like what questions from a medical standpoint would you encourage a client if they're like, hey, Dana, I'm going down to Costa Rica, blah, 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 blah. What kind of questions would you want to lob at them for them to get to think about from a medical standpoint, the safety in which the facility and the facilitators have?
Yeah, so I think that obviously it's ideal if there's a medical provider on the premises, right?
Okay.
That is nice to have. And there are certain ayahuasca retreats that have that. And actually, we're opening a licensed psilocybin center here in Golden called Entheogen. And what sets us apart there, one of the things, besides we grow our own medicine, is that we have on site medical support. So there are a lot of therapists who are working either in underground or above ground, and they're working with people in their offices or in their own homes, and there's no medical support. And several times in a ceremony, you'll have someone who is like, I'm dying, call 911. I have chest pain, right? And the therapist is afraid, right? And to know that there's someone medical who can help that person, that's a big like weight off the therapist's shoulders, right? So
Absolutely.
yeah, I think that asking, is there medical support? How far away is medical support if it's not here? And, like when I first started working with plant medicine, the fact that there was a paramedic there was really comforting to me, right?
I
Really
can
comforting.
imagine.
Yeah. And, also that's like was part of my control piece, right? And the more experiences I've had, the further I've actually gotten away from that, where it's, I'm relatively young. I don't have any medical problems. And I've had enough experiences to know that it's safe for me, right? So also it's like, is this your first experience with this medicine? Maybe you don't want to go sit in the jungle of Putumayo where there's not any medical support around you.
Yeah.
Right? It's pretty far.
Yeah, absolutely.
So, and I think like, it's obviously younger people without any medical problems who aren't on any medicines have a much lower risk, right? The older you get, the more medical problems you have, the more medications that you might be taking that are interacting, the higher your risk is.
What are so I told you before we jumped on the call about Stacy, and her interview will probably be out before this one, about her having a physiological healing, whether that was her and I discussed whether that was quite literally the medicine healing her, or her psychology getting to a point where the medicine could heal her. Whole fun discussion. But what are some of the physiological, and if you can share, stories that you've heard or you've experienced where it's not getting enough attention or discussion around, hey, there may be not just obviously, trauma from abuse, military experiences, accidents, obviously from a provider standpoint or from a psychotherapist standpoint, as a counselor, we're hearing more and more and more about it being used as a treatment for trauma. But what are some of the physiological stories that you've heard or experienced?
For me personally, I've had the medicine tell me that if I don't stop doing X, Y, or Z, then I'm going to get X, Y, or Z. Right. So it's more of a preventative, hey, you need to really scale back that, or that sort of thing. I have heard of people, I wish I knew this story really well to tell it, but a person had I think it was an ear, nose, and throat cancer. I think it was a tongue cancer. And the medicine told him, and that he went and had it evaluated, and that was what was happening. So
Wow.
I've definitely heard of that. I would say that I don't hear of that a lot. It's not a very common thing that I've heard, but it definitely exists.
Yeah. No, hearing because of our network of providers, obviously 110 plus, a lot of individuals have clients that end up going, and I've heard quite a few anecdotal, and they're not my stories to share, but pretty profound areas where it seems like there's some profound physiological healing. So I'm excited to continue to hear what comes up in the coming years and gets into the literature as well. It's just more evidence I think to have further discussions. Okay, so from your medical professional standpoint, if we're going to create a hierarchy, which psychedelics are the most maybe intense or impactful from a physiological standpoint? Like, I don't want to say like the worst trip, because that, obviously that's not very clear language, but which ones do you think, if you were going to order them, require maybe a little bit higher level of accountability when it comes to medical, but also just, hey, if Chris, you're going to go do ibogaine, that seems to be pretty intense, and ayahuasca is maybe a little bit lower, or how would you organize them?
So I think it's important to say that they're all dose dependent also, right? And so I would say ibogaine is pretty high up there, probably number one biggest ordeal. Okay. And also it's the one that's associated with death. It's rare, but it can happen, right? And it's the kind of medicine that you can do all the screening and echoes and EKGs you want, but if the medicine induces an arrhythmia, it induces an arrhythmia that might not have been picked up before, right? So the medical support that is around for that medicine is very crucial. I think that, all like psilocybin can be just as strong as ayahuasca. It doesn't cause the physical component as much. But, when you're retching for hours on ayahuasca, because that happens for some people, I mean, you can have an esophageal rupture. Like, that's something that can happen to people. And again, it's rare. But if you're, constantly in that retching space, because there are some people in ayahuasca ceremony that it's like, they're not just purging their own stuff. Like, they're purging the room. Like, that just happens to some people. And I've seen it happen quite a few times, where that one person is just really taking it the whole ceremony. But all these medicines have a duality, right? Like, it can be super forceful, like the force of the ocean, right? Mother Nature, because it is that. And it can also be this like sweet stream, it can be either one, and you can't predict what it's going to be. And so you can have that big experience with iboga or psilocybin or ayahuasca or LSD, right? And we're not talking about plant medicine, but LSD can be a really big experience for people. So, and again, the more you take, the bigger the experience. But also some medicines like ayahuasca, you can have one person who has 1 cup and it takes them the whole night. And then you can have another person who drinks 9 cups. And it doesn't really matter if you're a big man or you're a small woman. So it's very unpredictable.
What do providers need to be aware of across the board and I'm speaking, I'll ask a 2-part question. What do you think other medical providers need to be aware of if their clients say, hey, I want to do psychedelics? But the original intended question was, if you could megaphone to all the psychotherapists that are going to potentially be in the space or have a client come to them, what would you want to tell them about psychedelics if you had that opportunity?
I think that them being as prepared as possible, them being as informed as possible is the most important thing, but then also the supporting on the back end of that experience, right? Because so many people go to these ceremonies and have no support, right? And so making sure that that person has been appropriately informed, right? But also, like, there's something about indigenous cultures that don't inform people like that, like with the amount, but also like people in indigenous cultures are growing up in the jungle of Colombia or in other places, right? They don't have all of this stuff around us all the time. We're different, right? We're really different. And, they don't have like a litigious culture like we do. Like, we have a lot of other stuff going on. right? So while in traditional Yahe ceremony, the preparation for the local indigenous community is one way, and it's wildly different for Western people who are coming, right? Because we didn't grow up in that culture. We have no idea, like half the stuff, right? And so I think I think that the therapists really need to understand, like, who is their client, right? Why is their client wanting to go? Is their client wanting to go for their own healing, or is their client just wanting to kind of like be a part of the group to talk about, psychedelics? Like, they just want in on the group, so they're going to just do it, right? And then the preparation is so important.
This may be an unfair question, but as a medical provider, have you seen a psychotherapy approach paired with integration that seems more helpful than others?
I think that IFS is the one therapeutic modality that I have seen that really complements psychedelic work like nothing else. It is really beautiful what Dick Schwartz has put together. And just like, even like in the preparation and getting someone to know the parts of themselves, right? Like, if I had some sort of an awareness of like my mama bear part and my doctor part and, my, like, all of it, right? Like, because the psychedelics give your parts this microphone, right? And like, they get to come up and like start talking. And I think if you understand the language, then it also helps you with the integration piece in the back end when you're doing IFS, like from the beginning.
Yeah. And just for those that don't know, IFS is internal family systems. And this is a really crude description, but basically the theory looks at the different parts that make up you and how those different parts interact. Some of them, there could be a protector, there could be a childlike part. And at different times, it looks at how they manifest in your personality and in your day-to-day life, and what roles they occupy in kind of the culture you live and breathe in, both big C culture, but small C culture, and even intrapersonally, I would say as well. Would you say that that's a fair description?
Yeah, I like to think of IFS like all the different parts of yourself are on a school bus, right? And then who's driving the bus? Is it your angry part? Is it your sad part? Is it your perfectionist? Is it your doctor part? Is it, but also, like, I think it's important to identify that the other being taking up a seat on the bus is your soul and your true self and who you really are. Right. And so, and when you start working with IFS, you start to identify those parts in yourself, but then also you can see them in other people. And you could turn on the news and you can see what part of that person is standing there screaming, and it helps you in your relationships to see people. And, the goal is to really embody as much self energy as you can, right? And you're in self energy when you're calm and you're clear and you're courageous and creative and connected and all these things that start with C. And you can identify when you're not in it, and then learn more about yourself.
Personal question: how much did COVID prepare you to challenge or look at your doctor part once you?
Ton. I used to, if someone would call me, I had to have the answer to every question. If I didn't know it, I would look it up. And now sometimes I know it and I just say I don't know, because I don't need to know everything and I don't need to be everyone's doctor anymore. Like, that was brutal. And while I love to help my family and my friends, it's just not what I need. It's not like the top of my list of things I need to be doing anymore.
Yeah. I was just reflecting on your story and thinking about how timely and stressful that experience must have been as an infectious disease doctor, and being quite literally on call, but also on call with family, relatives, and whatnot. But how much that stress, but also maybe erosion in some of what you believed in modern medicine actually prepared you for what you were about to experience when you did ayahuasca. And yeah, I was just curious about that.
Yeah, I mean, it also shined a light on the lack of support we have as physicians, right? Because from the moment we walk into that hospital to the moment we go to sleep at night, honestly, because we're on call, we're traumatized all the time. We open a door, trauma. You see someone suffering, crying, recovering from surgery, massive infections and horrible, horrible life stories that got them to these places, right? Like the IV drug abusers who are coming in with Hep C and necrotizing fasciitis, they're going to lose a limb. Like these things are brutal to see once, but it's constant. I mean, just like what you guys see, it's different, but it's a lot of trauma.
Yeah. Yeah.
It's more controlled trauma. We're like more in a controlled trauma space, but it's still incredibly dysregulating for your system.
Absolutely. Yeah. And as human beings, I talk about it with my students fairly regularly. You're going to have what I call sticky clients where, there's secondary trauma, quite literally, like their story for whatever reason is going to stick in your psyche, and you're going to find yourself, a day later replaying everything that client said because it was so intense or hit you so hard. And now, if you're not addressing that and working on your own stuff, you start to become impaired to a certain degree. So anything, Dana? I know I was kind of all over the place. Hopefully I didn't push in too hard on some of you personally. I think obviously your professional and personal life are interconnected, and hearing your story, but anything that I didn't get to that you wanted to say, hey, this is really important, or you wanted to share with our audience?
No, I think we covered a lot of good ground.
I do too.
Yeah.
I really appreciate your time. I know time is money to any professional, but at the same time, I'm very thankful that that Lindsay connected me with you, but also that I got a chance to meet you. I personally plan on, if it's okay, as I continue to work with my clients, probably pointing them to you and asking a few questions along the way, just because in this time where everything's so disorganized, I think being able to find somebody that works in this space that obviously is a trusted professional, you're invaluable, and those contexts are invaluable. And I think also what you said, the educational piece for us as clinicians is extremely important, because at the end of the day, we're supposed to only deal with the psychological, but we all know that, it connects to everything else. And so if we don't have that interdisciplinary team, if they're not within our office as clinicians, we're left to create them ourselves. And if we're not having some of these conversations and getting out, quote unquote, into the marketplace and meeting other professionals that have some sort of intersection with our clients, obviously we're doing ourselves and our clients a huge disservice. So just on a personal level, I'm really thankful to meet you and learn from you, because obviously you've got a ton of information that I think can keep a lot of people safe.
Thank you. It was great to connect with you.
Yeah.
Thanks for having me.
Absolutely. Anything else before I let you go?
No. I think if anyone wants to connect with me, they can always email human@skylightpsychedelics.com, the website Skylight Psychedelics. Yeah, and feel free to reach out to me anytime.
Yeah, I'll put whatever information you want in the show notes. We'll put it in the show notes. But Dana, thank you so much for coming in.
Thank you. Thanks for having me.
Thanks for watching. Please like, comment, and subscribe wherever you're watching or listening. And please share this content with your networks.